What did early humans do when they got sick or injured? It's easy to imagine they had little choice but to accept their fate and hope for the best. But the evidence tells a different story. Early humans practiced medicine, dentistry, and even surgery. So, let's dive straight into it. For early humans, injury was part of everyday life. Hunting large animals meant getting dangerously close to creatures that were bigger, faster, and considerably less interested in fair play. Falls broke bones. Stone tools opened wounds. Burns, bites, and infections were constant threats, and without antibiotics, even a small injury could become deadly. But prehistoric people did not simply abandon anyone who twisted an ankle. Ancient skeletons often show fractures that healed years before death. Some individuals survived several serious injuries, suggesting they were protected and cared for while they recovered. One famous example is Shanidar I, a Neanderthal who suffered a major head injury, damage to one arm, and a fractured foot that probably left him walking with a limp. Yet he survived for years. That may have required others to gather food, help him move, and protect him when he could no longer contribute in the same way. We should be cautious. A healed bone proves survival, but not who treated the person or how. Sadly, it also cannot confirm whether the tribe had a prehistoric receptionist taking appointments. But it does show that serious injury was not always a death sentence. Before medicine became a profession, healthcare may simply have meant refusing to leave someone behind. Early humans had no doctors in the modern sense. There were no qualifications, medical schools, or framed certificates on the cave wall. Healthcare probably began with practical actions performed by ordinary members of the group. Wounds could be washed, dirt and thorns removed. Pressure could slow bleeding, while animal hide or plant fibers may have protected the injury. Broken limbs could be supported and kept still. Someone with a fever could be given food, water, and warmth. None of this required detailed knowledge of anatomy. It required observation. People would have noticed that clean wounds healed better than filthy ones. Injured legs benefited from rest, and patients were more likely to survive when cared for. Useful knowledge could then be remembered and passed on. Some people may eventually have become especially skilled at treating wounds, recognizing medicinal plants, or assisting with childbirth. But early healthcare was probably less like visiting a specialist and more like everyone doing what they could. Archaeologists call this the bioarchaeology of care, using physical remains to estimate the support someone needed to survive. A skeleton cannot preserve the person who brought water or sat beside the patient through the night. But sometimes the healing it records tells us that somebody did. Care alone could not solve every problem, so early humans also looked to nature. Plants could be crushed, chewed, brewed, or pressed against the skin. Some may have eased pain, settled the stomach, or protected wounds. Others taught a valuable lesson about which berries not to eat twice. Finding useful remedies required generations of trial and error. One person eats a leaf and feels better. Another eats something similar and spends the afternoon reconsidering every decision that brought them here. Remarkably, traces of these plants can survive in hardened dental plaque. Researchers examining Neanderthal teeth have found yarrow and chamomile, plants with little nutritional value but long associations with medicinal use. In another Neanderthal with a dental abscess, they found poplar, which contains salicylic acid, a chemical relative of the active ingredient in aspirin. That does not prove the Neanderthals understood chemistry or kept a pharmacy beside the fire. But early humans knew their environment. They could distinguish edible plants from poisonous ones and recognize unusual effects on the body. It would be surprising if they never used that knowledge when somebody was sick. Sometimes herbs were not enough. Prehistoric skeletons often show broken bones that healed successfully. Some fractures healed neatly enough to suggest the limb was supported and immobilized. Whether this involved a carefully made splint or simply ordering the patient to sit by the fire and stop moving, both approaches were medically sound. Dental treatment was less gentle. At Mehrgarh, in what is now Pakistan, archaeologists discovered teeth deliberately drilled while their owners were alive. The holes were made with tiny flint tools, possibly adapted from equipment used to make beads. Dentistry may therefore have begun when somebody looked at a stone drill and thought, "That works beautifully on jewellery. Open your mouth." The teeth date back around 9,000 years, and experiments show the tools could cut enamel surprisingly well. Whether anything dulled the pain is unknown, although the patient presumably developed an impressive grip. Prehistoric surgery went further still. Trepanation involved scraping, cutting, or drilling a hole into the skull. It appeared in different cultures and may have been used for head injuries, seizures, headaches, mental illness, or ritual purposes. Many trepanned skulls show new bone growth, proving the patient survived, sometimes for years. A few even survived the procedure more than once. That required genuine skill. The healer had to remove part of the skull without cutting too deeply or causing catastrophic bleeding. There were no anesthetics, sterile theatres, or reassuring surgeons. Just a sharp stone tool, several concerned relatives, and an appointment you desperately hoped would be cancelled. Crude though it was, the evidence suggests some early healers understood the human body far better than we might expect. Illness was far more mysterious. A healthy person could wake with a fever, shake uncontrollably, or struggle to breathe with no obvious cause. Without knowledge of bacteria or viruses, early humans explained these invisible threats through the world they understood. Perhaps an ancestor had been offended. Perhaps an enemy had placed a curse. Or perhaps a malicious spirit had entered the body and refused to leave. These ideas were wrong, but not entirely irrational. Illness appeared suddenly, spread between people, and vanished just as mysteriously. Something unseen was clearly at work. They were right about that part. They were simply several thousand years away from inventing the microscope. Treatment may have involved chanting, dancing, smoke, charms, or attempts to drive out the offending force. A healer might combine practical knowledge of herbs and wounds with spiritual authority. The same person could prescribe a useful plant, then spend 20 minutes negotiating with a demon. Medicine and magic may not have been separate categories at all. A herb, ritual, and group support could form part of the same treatment. Some of it may have helped, some offered comfort, and some mainly ensured that the evil spirit had a memorable evening. For many patients, the most effective treatment was not a plant, ritual, or sharpened stone. It was other people. A badly injured person might be unable to hunt, gather food, travel, or defend themselves. Alone, their chances were poor. Within a group, they could be fed, protected, and given time to recover. That care came at a cost. Food was valuable, and everyone had work to do. Yet some prehistoric people survived serious injuries and disabilities for years. They could not have managed without help. Someone brought food and water. Someone helped them move, cleaned their wounds, or kept them warm. And somebody probably listened while they explained for the 12th time exactly how large the animal had been. Healthcare is not only about curing disease. It is also about reducing pain, providing comfort, and making sure someone is not alone. Early humans may not have understood infection or anatomy, but they understood vulnerability. The tribe itself was the safety net. The first hospital may have been nothing more than a sheltered place beside the fire, and people who decided one of their own was worth the effort. Childbirth was another area where practical knowledge mattered. Giving birth was dangerous, but common enough for experience to build across generations. Women who had already given birth may have helped others through labour, cared for newborns, and recognised when something was wrong. They may also have known plants that reduced pain or bleeding, although the details are almost impossible to reconstruct. This knowledge was passed through memory and demonstration rather than written instructions, which was fortunate because a prehistoric maternity leaflet carved into a boulder would have been inconvenient to take home. Experienced birth attendants may have been among humanity's earliest medical specialists.
How much of prehistoric healthcare actually worked? Some of it probably did. Some of it almost certainly made things worse. Cleaning wounds, stopping bleeding, supporting broken limbs, and using certain medicinal plants could genuinely help. Rituals may also have comforted frightened patients, even when they had no physical effect. Prehistoric medicine was crude and often powerless against serious disease, but it was still medicine. Long before doctors and hospitals, someone was hurt, and somebody else tried to help.